when we talk from the makeup, right? People put eyeliner, people put kajal. Does that also impact the eye health?
I guess it would, in theory. These are all chemicals essentially, right? And we are deliberately applying them around the eye. I won't say in the eye, but they do go up to the eyelashes, and some of them will find their way in. You'll be surprised to know that the inputs from the eyes comprise almost 80% of the entire brain's inputs. But the eye just gives it so many terabytes of information that 80% of its processing power is essentially going towards looking after inputs coming from the eyes.
But why do people not go to an eye checkup or get an eye checkup very regularly? Is it because of the fear? Is it because lack of awareness? Is it because a lot of myths are there around? So what do you think is the major reason? But today, if I see, if I visit a school, I see a lot of students who are in these classes. I feel the number, how people take care of lens of their eyes, that has changed, or is it because of the AQI? Is it because of the lifestyle that we have adopted?
So there are damaging rays in the sun, undoubtedly. The infrared region as well as the ultraviolet region of the spectrum have had influences on the eye.
And when we talk from, there are lenses also now, Blu-ray lenses which has come out, or screen protector lenses which has come out. How beneficial are those actually when it comes to, doing the screen work?
So I think they're overhyped.
And most of the people, until they have a bad migraine or they feel the pain in the eye, they do not actually go to the doctor and see if they have a number. How do you actually feel that you have a number? When is the right age to get that checkup done, if there is any? Or how regularly should you get these eye checkup done? Welcome to Peekapod, a podcast that inspires the young to think beyond the obvious. Close your eyes for 5 seconds. You now imagine that blur. That is a reality for thousands and millions of Indians today. A few years back, I had visited Dialogue of Dark. Definitely that grew my empathy towards visually impaired and people who suffer from blindness. But that also gave me a quite privilege of understanding how important is a healthy eye. For the same reason, I bring you today's episode. Joining me is Dr. Rishi Mohan. He has been assisting eye surgeries for renowned names such as Atal Bihari Vajpayee, and now treating very rare and specialized cases when it comes to eye surgery. Welcome to the podcast, sir.
Thank you so much. Thank you for having me.
So, sir, I wanted to start this podcast by understanding that how important is eye health and how underestimated is eye health in India.
It's a good question. I think the eye is the primary sense organ of the body. You'll be surprised to know that the inputs from the eyes comprise almost 80% of the entire brain's inputs. So the brain is getting inputs from the nose, the ears, the mouth, and the other parts of the body. But the eye just gives it so many terabytes of information that 80% of its processing power is essentially going towards looking after inputs coming from the eyes. So it's by far the primary sense organ, and therefore it's our responsibility in many ways to look after it. And so that's a very valid question and very, very applicable in today's age.
So, you mentioned it's a very important sense of organ. But why do people not go to an eye checkup or get an eye checkup very regularly? Is it because of the fear? Is it because lack of awareness? Is it because a lot of myths are there around? So what do you think is the major reason for this? And also, what is the major reason people generally, get a sense of responsibility to eye only when they suffer a certain thing? So what is that reason behind?
So I think it's a multiple reasons for it. Some that you've already mentioned about awareness, some because they're afraid that something might get picked up,
Hmm.
and some is just neglect, unless there is a real problem. Also, the eye is a binocular organ, right? So if
Right.
one eye is there's something going wrong, it is often missed
Yeah.
because the good eye is covering for it. The other thing, I think nature gave the eyes a lot of extra privileges and made it a fairly self-sustained organ. And things don't go wrong, they do, but
Hmm.
things generally are doing quite well in the eyes for most people.
Right. But sir, when we see today's youngster, we see that a lot of them, I mean, when I was in school, I did not see a lot of my classmates wearing lenses or wearing glasses. But today, if I see, if I visit a school, I see a lot of students wearing these glasses. I feel the number, how people take care of lens of their eyes, that has changed, or is it because of the AQI? Is it because of the lifestyle that we have adopted? Why is that so?
I think again it's a bit of both. There are environmental influences in us, and there are just what used to be lack of awareness. On average, about 40% of any class in school, the kids should be wearing glasses. But if you actually go and take a survey, it's much shorter than that, which means that many of them are being missed. And that's where the relevance of school eye health programs comes in, and how the kind of things that we do, we go and just look at these children to see if they can pick up any such deficit. The environment, yes, near work has gone up a lot in the young children, and we know that progression of these powers is linked to the number of hours you spend on near work. Near work doesn't necessarily mean screen work. It could mean near reading work also. That also has a contribution to play. The near screens probably a bit more, but even reading work, and there are ample evidence now in terms of studies which have shown the link between children who spend more time outdoors and children who spend more time on books and reading screens, and the onset and the progression of myopia.
Okay, you mentioned that there's a difference between outdoor and indoor as well. But from my study, what I saw was that even the sunlight or even the sun rays actually affect your eyesight a lot. So, does that also plays a partial role in?
So there are damaging rays in the sun,
Hmm.
undoubtedly. The infrared region as well as the ultraviolet region of the spectrum have had influences on the eye. But I think the exposure to the sun has so many other benefits,
Hmm.
and the fact that you're spending time outdoors probably overcomes this to a large extent.
Understood. And specifically with these technologies such as glasses coming in, the digital glasses, the AI VR glasses. Now you said that workers also contribute to reading, and that is something that is giving a screen for 24 hours, right? How can we contribute to that, or how can we reduce that? I mean, definitely reducing screen time or not giving different type of glasses of different brands to students or kids is one thing, but specifically we are moving towards the digital India. We're moving towards digitalization that much that we're used to screen time all the time.
It's a double-edged sword.
Yeah.
You can't, I think in the modern era, screens are here to stay.
Right.
We will have to deal with them. And so a little bit of regulation, simple common sense things, taking adequate breaks is all that's really needed. Professionally, there's so many people who have to sit in front of screens for hours, 14 hours a day sometimes. So they would be terribly disadvantaged. The onset of dry eye, the onset of eye strain, the onset of what we call digital eye strain or digital eye syndrome, which is essentially another term for computer vision syndrome. These are the new terminologies that we are using for patients who get affected by screens and excessive near work. The use of glasses, yes, but it cannot go beyond a point. Uh, I think just the improvement in the screen qualities have made so much difference as compared to what they were. But yeah, regulation, ensuring that you take breaks. And earlier we were discussing about that 20-20-20 rule, which essentially stated that every 20 minutes you should take 20 seconds off and look at things which are at least 20 feet away. So modifications of those rules exist. Apps have now come up, which you can put onto your system, which will pop up every 20 minutes, reminding you that you need to take a break. So these are all advents and attempts to make eye care, and the patients a little more comfortable.
Okay. And when we talk from, there are lenses also now, Blu-ray lenses which has come out, or screen protector lenses which has come out. How beneficial are those actually when it comes to, doing the screen work?
So I think they're overhyped.
Okay.
So if you look at what they call the blue cut lenses around, this is not new technology. It's been there for years and years. It's just that it was not commercially exploited at then, and when it was actually relevant. Because if I talk about the screens of 20-25 years ago versus the screens of today, there's a huge difference in the resolution, the refresh rates, the kind of radiations they emit, and the kind of color tones. They're all now LED, LCD based rather than cathode ray tube based. So those screens are very different, and they are far less damaging from a radiation perspective. So when we talk about these new glasses, they're really, in today's era, ineffective completely.
Okay. And what do you suggest? Should people go for LASIK? Because we talk from glasses point of view, but people also opt for contact lenses. People opt for LASIK. Is that an ideal situation? Should you go for LASIK or should you not? Should you opt for glasses largely?
So if I were to use a broad term, there is nothing wrong with LASIK. It's a brilliant technology. It works absolutely wonderfully well in the vast majority. There are patients who are not good candidates.
Okay.
So that's where the screening and the evaluation protocols come in. So we have to identify those who are not good candidates, tell them why they are not good candidates, and dissuade them from getting these done. If that's the case, the number of patients who develop complications and numbers who don't do well with non-optimal outcomes, we can avoid a lot of that if the screening is of high quality.
Okay. And how do we find a good candidate for that?
A good candidate in terms of the patient?
Yes.
So a patient doesn't know. The patient is wearing glasses, desirous of not wearing glasses, comes in. So we naturally go through the history, how long he's been wearing glasses, the contact lens use, and then we start to evaluate from the front all the way to the back. So we look at the dry eye, we look at the cornea, we look at the curvature, the thickness, the strength. We look at other aspects inside the eye. The retina is examined to see whether there are any weak areas. And based on that, the binocularity, what kind of muscle balance exists, what is the kind of work being done by that person, and stability of the power is a very, very important rule, because if you are operating or planning to operate on a patient whose powers haven't yet stabilized, you'll probably land up with some amount of residual power, because growth will continue to happen even after the laser is done. So the laser will only do what you feed it. So if you feed power X and the power is eventually going to become Y, that X minus Y difference will come up later.
True.
So you have to ensure that the patient has hit whatever plateau levels have to be reached, and only then take up the patient.
Is it also linked to genetics a lot? Does your eye number is influenced by probably your parents putting in glasses as well?
Yes, it is. And one parent wearing glasses, both parents wearing glasses, the quantum of the power, they all have a role to play. Other than genetics, then the influence of the environment and the way the child grows up, and the way the child is, the screens and all, and the amount of near work that the child does influence the way the growth will happen.
Okay. So what is the best lifestyle for keeping a healthy eye? You mentioned that, it's largely influenced by the kind of environment we grow in. So, what is an ideal atmosphere and an ideal lifestyle for a healthy eye?
I don't think there is any ideal. The eye is beautifully adaptable
Mm.
structure. It will adjust to deserts. It will adjust to
Mm.
minus 40-degree temperatures. It will adjust to the heat and to the cold and to the
Mm.
humidity. From a working perspective, I think balance, and that balance is nutrition.
Mm.
The balance is hygiene. The balance is ensuring that you don't allow diseases to develop. Wear your glasses, have the glasses assessed at the right time so that they are accurately prescribed. And basically, if something amiss is picked up in
Mm.
any of those evaluations, then appropriate therapy has to be advised. But other than that, I think there is no ideal environment that's been described.
Okay. And most of the people, until they have a bad migraine or they feel the pain in the eye, they do not actually go to the doctor and see if they have a number.
Mhm.
How do you actually feel that you have a number? When is the right age to get that checkup done, if there is any? Or how regularly should you get these eye checkup done?
Okay, so that I think question can be broken up into two bits.
Hmm.
The first is what are the defined ages at which these checks should be done, and the second thing is how does the patient realize that he or she is not
Hmm.
seeing well. I think one thing that we all have at homes is a television,
Hmm.
and if the person sitting beside you is able to read everything on that TV, right down to the scripts that are running or the smallest fine print on it, and from the same distance you are not able to, there's obviously some subnormal vision.
Hmm.
Whether it's glasses or something else is a
Hmm.
different story, but at least you identified that
Hmm.
there is a problem. And very often, like I said earlier, the problem can be in one eye.
Hmm.
So once in a while, it's not a bad idea to just do this.
Okay.
And you'll instantly know whether my two eyes are identical or not, or
Yeah.
one is underperforming, which would again take you back to the doctor for him to
Right.
then decide what's the appropriate line of management. As
Understood.
far as the other question was as to what's the
Hmm.
ideal ages, what is recommended is that the first checkup for a child should be done at preschool.
Okay.
So preschool is the time when they're about 4, which is the time when they become a little alphabet ready, and they're able to come to a eye doctor and be able to read the charts or some of those things so that the doctors can get an idea as to what the vision is like. And then depending on that visit and the growth of the child and the family background, genetics, like you mentioned, if both
Hmm.
parents are wearing glasses or if the siblings, the other brothers, sisters have
Hmm.
already wearing glasses, chances are that this child will be more prone to develop the same thing. So they need to come in sooner, maybe every year or every couple of years. And then you need, if there's a perfectly normal, healthy child with no glasses, nothing, maybe once in 4 or 5 years, they can continue to get checked. And that once in 5 years checking can remain till they are in their early 40s. After which, again, aging aspects start to come in, and then the timelines again change. The presence of other conditions can come in. You may become hypertensive, diabetes may come in. So those
Hmm.
would be then reasons to change that approach.
Hmm.
But this by far is good enough. Once in a few
Hmm.
years, a routine eye check is all one needs.
Okay. And I think one important thing, other than weak eyesight, that a lot of people in India specifically faces is cataract or
Mhm.
a cataract eye, and specifically the age for that is reducing. Why is that happening so much?
I think the age is not actually reducing.
Okay.
It's just that we are picking it up early.
Yeah.
So I don't think there is a reduction in age. If anything, I think with the improvement in nutrition and hygiene and whatever environmental influences there are, the age at which we are operating cataracts is actually becoming later. So
Okay.
as we will age, our longevities will go up. Cataracts will also happen
Hmm.
more often, but they will happen at a later age. So I don't see any real reduction in the age at which we are operating these patients.
Okay.
The age of diagnosis may have gone up
Hmm.
simply because of the awareness. When the patient isn't doing well, and I would thank our opticians, because most of them when you are not seeing well, you'll go to the chashme wala
Yeah.
to try and see if he can give you better glasses, and then he'll examine you, and then he'll realize that he can't improve you. So then he'll tell you, listen, you need to go and see the doctor because your vision isn't getting better, and that would be the reason to then see the doctor. It may not be a cataract, maybe something else, but
Right.
at least that's how many of our cataracts actually we discover.
And in fact, so that brings me to an interesting question, that a lot of, eye opticians now, the one who makes glasses, have started to do eye test. Right now, people actually don't go to a real doctor. They say कि पास वाले आई कैटलिस्ट के पास जाकर उससे नंबर चेक करवा लेते हैं if it's same or not.
Correct.
Right? What is the difference when you go to a doctor and get it properly checked versus you go to a nearby place and get it checked, if there is any difference?
So there will be. So remember when the whole system of eye care was being developed,
Right.
there were the personnel like myself who came through the medical background. We are trained to handle disease, we are trained to handle abnormalities, we are taught how to operate, what medications to prescribe, and so on. We're also trained on the refractive side, which means the side where glasses, powers, and all come in. But in our teams, we have technicians who are very good at doing checking out glasses. But then their limitation is that. So the whole idea was that the doctor, who is trained to do so many other things, should not be spending time giving people's glasses. So this whole cadre of technicians was created to take that unnecessary load off the doctor. And so some of them are trained and are very, very good, and they can give you glasses with extreme accuracy. Even in institutions like my own, we no longer actually check the powers. We are again have trained technicians to do the same. So to that extent, it's the same. But once the trained technician is unable to fix the power and get the vision to a satisfactory level, obviously we are dealing with a problem. So that's where the good technician should figure out that, you know what, I've reached the limits of what I can do, and we need to refer this on to the doctor. So very many of us will come across the patient only because the optician has been unable to fix the problem. But otherwise, the approach is the same.
Understood. And can you ever restore, myopia or hypermyopia? There are a lot of brands that claim or give, refreshments that say that this eye drop may cater or better your eyesight. Can that ever happen, or can that not happen?
Can it ever happen? Maybe a difficult question to answer. I'm sure it might at some stage, but actually myopia and these refractive errors, what we call them, are structural changes. So once a structural change has happened, reversing a structural change without actually doing something to the eye doesn't sound right. You actually have to go in and make some modifications to reverse that structural change, like doing a structural change yourself. What one can do, and which has really come up over the last 10 years, is to try and see if we can stop the myopia from progressing. And that's typically for the pediatric age group. And it is very robust scientific technology in the form of drops, in the form of certain special glasses which reduce the pressure on the ocular system, and in combinations when managed by a good group of myopia specialists, which are essentially eye doctors, you can get excellent outcomes in terms of reducing the speed of growth for these young kids. So that is something that must go out as a message, that myopia in the progressive stage, when the children are young, there is control, very high quality control management systems in place. You must go to the doctor. Just don't get the next glass made and then the number goes up by 0.75 and then get the next one made and the number goes up by 1 and then get the next one made. Make an attempt to see the eye doctor who will be able to guide you as to the best way forward.
Understood. And there have been a lot of facts or myths, as we might call. But they say that maybe walking on a grass can reduce your number, doing a lot of exercises can reduce your number. Does that reduction happen through exercises? Does it make your eye muscles stronger? What is the logic behind that? Or are these just pure myths?
There is no scientific evidence to support these
Hmm.
claims. As simple common sense, and being in India, we are always tuned with our own Indian systems.
Right.
So there is much to say for the positivity in that. It may not specifically translate to ocular health, but there's the positivity in waking up early in the morning and just trying to tune yourself with nature. What's wrong with
Hmm.
that? I think it's absolutely brilliant. But whether it will reduce your power, there's no evidence that would suggest it will do so.
Understood. And how we definitely discussed that the first eye checkup should be done at age of 4, but how frequent should these eye checkup be?
So at the age of 4, if nothing is discovered, we can let the child comfortably grow and call him or her back in about 3 years. But if anything odd is noticed by the parents in that intervening period, naturally you'll come back sooner. A squint
Hmm.
may develop, or they may get the feeling that you're going out for a drive and everybody's able to read a signboard and the child can't.
Hmm.
So obviously there's some mismatch happening. So that would be reasons for the child to come back. A child with family history,
Hmm.
like I mentioned earlier, the older sibling is wearing
Right.
glasses, then this 3-year rule doesn't work.
Hmm.
Then that child may need to be seen sooner.
So, sir, my next question to you is when we talk from the makeup, right? People put eyeliner, people put kajal. Does that also impact the eye health?
I guess it would, in theory. These are all chemicals essentially, right? And we are deliberately applying them around the eye. I won't say in the eye, but they do go up to the eyelashes, and some of them will find their way in. For the most part, they're innocuous, but sometimes some ingredients or some specific sensitivities by any individual to one of the ingredients can create an allergy. The other concerns that we sometimes see is that these pencils get shared, right? So if you are sharing a pencil, you are now transferring debris, you're transferring infection, and that can be a cause for concern. So we don't generally discourage people from eye-related makeup, but we do discourage leaving it on for too long, not cleaning it up well, or not conforming to the proper hygiene-related issues. Um, Not bothering if it's creating trouble for you. Obviously, there's something wrong, and definitely not sharing.
Understood. And in a lot of households, early on, culturally, people are said that put in kajal, that'll improve your eyesight, that'll improve your eyesight, or probably increase the size of your eye. Does that actually happen? What are the mismanagement or the misbenefits of that can happen as well?
I just think that's another misconception that we need to debunk. I don't think it adds any real value. From a cosmetic point of view, yes, but I don't think it has any value from any of the aspects that you mentioned.
Okay. And a lot of times there is a large debate between the doctors as well, whether to splash cold water on your eyes or not to. Should we not do it after LASIK? What is the procedure for that like?
So again, eyes are just like any part of the body which is exposed. We take a daily bath. We wash our face sometimes more than once a day. The eye is, like I said initially, beautifully structured. It has its own defense mechanisms. It has its own washing mechanism. Adding on to that with a tap water or an external water only makes sense if there's a reason to do it. And that reason could be you've come in home from outdoors, you've been in a polluted environment, you want to wash your hands. So wash your hands with soap and water first. So at least get the hygiene done there. Ensure the water quality is good. Part two. And then do a little bit of splashing and then gently just dab the eye and dry it. So nothing wrong with that. Perfectly acceptable. Something falls into the eye, stands to reason that you should wash it well. In fact, it's recommended that you should wash it well. Some chemical goes into the eye, mandatory that you wash it well. That's the first thing you should do. And but otherwise, washing it 4 times, 6 times, 8 times a day, and there was a patient who had actually come in who was doing that and was complaining that his eyes are not comfortable. I said, you're washing away all the good things that are there in the eye. And if had we designed to have water in the eye, we would have been born a fish rather than born as humans. We would have been underwater all the time. So we had a good laugh about it, but he understood what I was saying.
And when we talk from the perspective of, definitely refreshments or eye drops that needs to go in, so because maybe if something goes in, we generally opt out, we go to a chemist and buy a eye drop and put it in. So how safe is that, or should we first go to an eye doctor, get a recommendation and only put it, or are there few refreshments that you feel that okay, this is something that can be put in handy, but then there are other droplets which need a proper authorization of a doctor?
So I don't think there are any standard protocols on it. Something flies into the eye like a little gritty sensation. You start to feel, you understand that something has gone in. If it doesn't go away in a couple of minutes, first thing, don't rub, because by rubbing you can actually grind that whatever particle has gone in further deeper into your tissues, creating more trouble. So never rub. If something falls into the eye, again nature's defense will come in, which means watering will start. Very often that itself takes care of it. Very often washing is required. That means go in and then splash water. If that hasn't resolved the problem, then obviously whatever has gone in is there and needs more than just the simple things that you can do at home. So one is to ensure that you are seeing okay, and then yes, find your way to the nearest ophthalmologist. In the interim, at best, you can get an antibiotic drop from the chemist. I mean, if you go to the chemist, like you said, the first point of contact is the chemist, and the chemist will invariably give you an antibiotic drop. You can put that, you can add a lubricant as well. These are at least innocuous and non-damaging options. You certainly don't want to be putting a steroid or something like that. And then find your way to the doctor so that he can actually diagnose what the issue is.
Understand. And from the eye health point of view, I also want to move a little towards the eye donation part of it. How important is that? Where's the awareness for eye donation going? What is the importance of eye donation? So we can talk a little about that as well.
So eye donation is vital. The eye still has a lot of life left in us once we pass away. And again, the front aspects of the eye were designed to be able to extract oxygen from the atmosphere. So when death happens, the lungs stop supplying oxygen. So every part of the human body will die within minutes. The cornea does not, because it's taking oxygen from the atmosphere and survives much, much longer, many hours longer. And that's what gives us an opportunity for what we call eye donation. And now we are only actually extracting not the whole eyeball. The eyeball is not a transplantable entity. It's only the cornea. And now the cornea, we look at the components of the cornea, so that when we find a patient who needs a transplant, we try and identify which layer of the cornea is damaged and try and see if we can replace only that layer. But the cornea has to come from an eye bank, and the eye bank can only be supplied by a person who has just passed away. And so it's the next of kin who must take this call. And I think that would be a fantastic thing if anything that any doctor says can make this movement even a little bit stronger, because we are in constant short supply of corneas. And especially those who die young, unfortunately, like road accidents and things like that, where the corneas are of really high quality. Otherwise, they haven't aged, they haven't been operated. So the younger corneas are naturally better from a transplantation point of view. But even the older corneas are giving fantastic outcomes. Eye banking techniques, surgical techniques, the advent of lasers has made so much difference in the outcomes. And now what we call component surgery, which means we don't replace the entire cornea. We only replace the layer of the cornea that needs it.
Okay. And for how many hours does this eye actually, or the cornea actually stays intact? For how many hours can you actually, donate the eye?
You mean after death?
Yes.
So 6 to 8 hours is fairly okay. The sooner the better, because all said and done, the cornea will lose health. It derives, like I said, much of its oxygen from the atmosphere, but it still is dependent on other nutritional supplies to happen through the blood supply and so on, which has stopped, right? So it has to be come out, it has to be processed by the eye bank, and then has to be put into a proper storage, where it can then the life can be increased quite substantially, because it has to get distributed to the corneal surgeon eventually.
Okay. And another aspect is, what is the process like? Is it very difficult if a person has got done his LASIK? Can he also donate the eye? Like the next you can decide to give out the eyes.
Absolutely. So an eye that has had a LASIK done, we will not be able to use the front part where the LASIK is done, but we can use the back part. So like I said, and that's the beauty. Earlier, the concerns were laser hua hai, we can't donate this, iska cataract surgery hui hai, we can't donate this. So there were these concepts that were there, that these eyes are not donatable. Pretty much every eye is donatable. And the only thing that that happens infrequently is that the cornea, once it gets into the lab, we examine that and it's processed, and then for some reason it cannot be used. So then there is so much of training and so much of research that goes in. So the cornea is never wasted. It's always of use. So no one should feel that the cornea was donated and it wasn't, gainfully utilized. There'll always be a purpose where it will be of use.
Understood. And when we talk from the, innovation side of it, right now we are talking from the awareness point of view. When we talk from the vision, the future of vision, the kind of technologies that are coming in, how has that improved? How has that legacy come in?
Oh my God! If you, see change in technology over the last 3 decades since I've been actively involved. Amazing. Whether it is the lenses that we put in, and now the lenses have advanced to what we call the premium lenses with multifocality and all that. So cataract surgery, the technologies we now use, the kind of incisions we make, the precision of those incisions using lasers has revolutionized cataract care completely. We don't even use injections anymore. We don't use stitches anymore. And they're now walk-in, walk-out procedures. There was a time we used to admit patients for a week to get a cataract surgery. Now we admit them for 2 hours. So that's the kind of thing. Lasers have completely revolutionized the way ophthalmology is practiced, and they've become more reasonably priced. The availability has reached tier 2, tier 3, and even lower down, so that even the rural population has access to those. So that is another change that has happened. The advancements in diagnostics, amazing. We are able to see things that we were unable to see, and what you're not able to see, you can't comprehend. So that has again made such a difference. So advanced therapeutics, look at the medication, the quality, the preservative free medications have started to come in, which is We are now ensuring that we are not damaging the eye in any way when we are trying to treat, because we are not putting any chemicals in. So all this has led to eye care really just.
So, what do you think has been the role of technology, or how has the innovation in eye sector taken place?
I think if I look at any other specialty, I don't think there has been as much innovation and development in tech as in ophthalmology. Unbelievable. And I mentioned all the things just earlier where these things have happened, um, in diagnostics, in therapeutics, in microsurgery. There was a time when surgeries were being done with the naked eye, but now even the most basic surgeries are being done with these beautiful microscopes where things are magnified. So you get scars which you can't even see. You get incisions that you will disappear over time. The outcomes are so much more perfect. Uh, when we are calculating for certain things to be done in the eye, because a lot of the eye has optical principles, which is physics, right? So physics governs the way the rays of light move into the eye. So there's so much better understanding, and AI has come in to make those things so much more refined. The other thing I think AI is really helping out is going to be with screenings. So when we are looking at doing mass screenings for, say, diabetic retinopathy, right? The eye doctor can't go out into the villages and look at these patients. So a simple device can be used. You image the patient sitting in some village. Through the net, that image can get transferred. AI will tell us whether there is a retinopathy developing, whether it's impending, whether this patient is likely to develop these kind of issues. So much is happening on that front.
Okay. And so, I also want to discuss from the legacy point of view. It's been 4 generations you have been in this business of taking care of eyes, right? For others. Do you feel at times there's a pressure that has come along, or is there a tag that has come along? I mean, definitely that brings in legacy, but does that also bring in pressure at times?
It does, I guess. I mean, very few people know I'm a fourth generation ophthalmologist. So that is not something that is either advertised, or even we don't even wear it on our sleeve. The other thing is, two of those 4 generations would not really even impact us. Like my great grandfather and my grandfather were both doctors. My grandfather already had, because I had already come in as a specialization there, but that was erstwhile Pakistan. So uh, that was that side of the border now. My father, who most people are aware, and in fact, on whose name this institution is named, um, had to essentially run at the age of 70, uh, undergo all those rigors and trauma of partition, and then find his roots from scratch. So the legacy, as far as those 2 generations are concerned, I don't think really matters. But yes, the legacy that I inherited, which also is actually in many ways, I would say, developed together. This legacy wasn't a legacy that I've inherited. This legacy has been created, and the legacy has been created jointly, and which I would say I'm an equal partner. So, so there is a little pressure, because the person on whom this whole institution was based was a awesome figure.
Okay. And you have yourself come out of AIMS. There are few more doctors who have come. I mean, there are very specific, nurtured doctors who come out from AIMS. Do you think that also creates the pressure, or does that holds a certain kind of privilege that, okay, I understand the eye so well that probably, because recently I was reading that one of the eye surgeries in Gorakhpur, 19 people lost their vision. So how responsible does that institution plays a role, and what is the kind of ethics that come in when you are performing any kind of surgery?
So I think you've asked two questions which are slightly different. One, and let me get back to my alma mater and the training I received there. Uh, Nothing short of world class, right? I am fairly confident that we pretty much bring out the best ophthalmologists in the world. Definitely right up there, arguably. And the training we received, and our teachers, our colleagues, my seniors, even our patients whom we learn from, eternally grateful, because you can't get that exposure or that training anywhere else in the world. And I've been around, believe me. So I've seen residents from many institutions, and we are right there amongst the best. So it's a very proud feeling actually to be from the RP Center as a product. As far as that second unfortunate incident that you recall, it happens. It's not because of doctor failure, let me remind you. The doctor is only there delivering a service. When mass problems like that happen, it's something in the system, and these usually happen in systems where some things haven't really been looked at, which is more administrative or more because of finance or because of some slippage in some process that should have been done, whether it's sterilization or anything else. So when I, as a surgeon, I'm operating, I'm given a set of equipment to operate with. I don't have an idea how sterile it is. I expect it to be perfectly sterile. I expect the drops that I'm using to be perfect and not expired. I expect that the fluids that I'm going to use in the surgery are of high quality. However, the people who are either in the procurement of this process or somewhere, there's some lapse that happens, and that can lead to these kind of mishaps that happen. Very rarely is it the doctor's fault, honestly. Unfortunately, the doctor, being at the apex of that entire organization, is the one who's hauled up, and he's the one who's put in the dock, uh, which is unfortunate. But to an extent, I guess the doctor should also look at all this, and he does, but only up to a point, because there's so many other things that he has to do, and there is a whole cadre to look after these other things that they shouldn't be happening. But still, mass infections can happen on a mass basis, and in camps and where high volume surgeries have to be done, uh, the problem will get multiplied, because so many surgeries are being done together that if there's a problem in one, it may turn out to be a problem in many more. It's very unfortunate. Fortunately, these things are getting lesser and lesser. We used to read about these and hear about these much more often in the past than we are now, but still some slippage happens somewhere.
And so, like we were discussing earlier about, the responsibility and the attachment related to patients, we were discussing a few cases. Uh, how do you think generally doctor takes up these cases? Some specifically when you are at the apex of the body and you get attached and you see such kind of cases happening. Does it also affect you professionally or industry wise as well?
It does. I think a lot of that has to do with the individual personality of the doctor as well. Some of us get really involved with our patients. Uh, for me, at least, and that's something that we've always looked at from a sincerity and a compassion point of view, is pretty much to treat every patient as your family member, because then automatically you're looking at his best interest. Automatically you're looking at, if this man has to spend money, can I save him some, rather than your interest, which may be earn more money or do something without really looking at what the person can afford and all that. But we try and do that. I think that's a very individual thing, but we all get involved. I think I can speak for all my colleagues here. uh, they're very good doctors, and good doctors will always get involved.
Right. So that would also bring me to last two closing questions. So what do you think are the myths that generally people have when they're visiting a doctor? And which of them are myths and which of them are facts actually?
There are myths that are there. I mean, so let's see, let's talk about the pediatric group, for example. So, a question that we are often asked by parents are, oh, when will my child outgrow these glasses? There's only a very small subset of children who will outgrow their glasses. Most, on the other hand, it will get worse. So, this concept of outgrowing glasses is only applicable to a very small percentage of children. The second thing we often do, and as I mentioned earlier, is about how we have now good quality management for progressive myopia in children. And the medications and the treatment therapies that we suggest cannot be just used for 6 months. It's a project for as long as the child is growing. So it has to be understood, and we try a lot to tell the patient that these are, at least these are projects. These are not just one-time treatments that you would take for anything else. Then things like LASIK. I get patients who are now in their 40s and 50s who miss the bus in getting their laser done at an earlier age, and now come thinking that laser is a good strategy for glass removal at any age. It isn't. So once you get into your 40s, it's important to remember that your power is splitting. Now you have a distance power and you have a reading power. And there is no real laser which will fix both. So you are going to be largely dependent on glasses, even if we do laser you. So that comes as a bit of a surprise to them. So that is another concept that has to be brought in. Glaucoma. So I have glaucoma, I'm going to go blind. No, you have glaucoma, it's controllable. You just need to manage it. You need to ensure that you take your medications. You need to keep getting it monitored from time to time, and you can go through life without real damage. So, neglect or not putting your medications properly or not getting tested periodically is usually the reason why glaucoma patients will go blind, rather than because of they've been doing everything well and they've still gone blind. And cataract is another thing. There's people hear the word cataract and they say, oh, surgery is required. All cataracts don't need surgery. Early cataracts, you just probably need a little bit of fine tuning of the glasses. So cataracts can wait till they start to really impact your vision quality before you get them done, because nature's vision is still superior to what we can give it. So those are just some of the myths I thought that I should bring up on cataract, glaucoma, and many of these pediatrics and lasers that are there. Yeah, thanks.
And so, one more question. How important do you think sleep is for taking care of your eye?
So sleep is very important for every part of the body. Yeah, body needs rest, the brain needs rest, every organ needs rest. So does the eye. The closure of the lids allows the eye not to evaporate and get dry at night. The water secretion and the surface settles. Sleep is also extremely important, not specifically from an eye point of view, but from the point of view that light going into the system is cut out. And light is a stimulant. Light will not allow you to sleep well. If you spent a lot of time on screens, your sleep cycle may actually be impacted, because all that blue light energy that goes in is known to impact the sleep cycle. So sleep cycles are very important from a mental health as well as the physical health perspective.
And so, do you think dark circles also impact eyes in any ways, or is it a sign that you should go to a doctor? Is it also connected?
Dark circles around the eyes are
Yes.
more often than not largely a cosmetic issue.
Right.
From a functional point of view, very few people who are either extremely diabetic or who have kidney disorders or some skin disorders can be individuals who will have a dark eye problem, which is actually disease linked.
Okay.
But the vast majority are just because they are genetically ordained, and we are all dark skinned people.
Right.
The pigment depositions and distribution in our bodies keep changing, and the loose skin around the eyes is a natural area where some of this pigment and fluid will settle, giving rise to that look. But other than that, it's not a problem.
It has been a great honor to have you here, sir, and thank you so much for your time